Hi, I'm Dr. Shirley Soleiman, the founder, owner, and lead physician at Cosmetic Injectable Center. I've been delivering non-surgical medical aesthetic enhancements for my patients since 2010. I'm also a key opinion leader, faculty, and national speaker for leading companies. I've also been involved in clinical trials for these type of studies since 2016, which keeps me in the forefront of new technology in the non-surgical medical aesthetic field.
Hi, I'm Pamela Brogardi, licensed cosmetologist, celebrity makeup artist, specializing in film, television, and print. It's so nice seeing you today, Dr. Soleiman.
It's good to see you, Pam.
And today I'm going to be talking about a little glam. We're going to work on the eyes.
I'm so excited to get started today. I can't wait to add something new to my repertoire.
Agreed. And today we're going to be doing a light, versatile glam that you can go from day to night. And I think it's a really important skill set for you to have at home.
Amazing. Today, in addition to makeup, we're going to be speaking on behalf of RVL Pharmaceuticals. So we'll be asking about something that I see a lot in my patients and that you might have some experience with as well, Pam.
Tell me more.
So I want to talk about droopy eyelids, also called blepharoptosis. Try saying that 10 times in a row. Acquired ptosis is a condition where the upper eyelids sit in a lower place than average, covering some of the iris and sometimes even the pupil. Lid heaviness can happen either from aging, where the ligaments and skin around the eyes get loose, or from medical conditions that involve muscles, nerves, or fibrous tissue in or around the eyes. Droopy eyelids have the impact of displaying a tired appearance on those who have them, even if they're not tired.
Wow, that is so intriguing. I just had a client ask me about droopy eyelids and what I could do to help lift them by doing makeup. So I can't wait to hear more about it.
See, like I said, it's really common. And today, I want to talk more in depth about what ptosis actually is and how patients with ptosis or droopy eyelids view their condition and what treatments are available to them. A lot of people don't know what options are available other than looking into surgery as soon as they realize they have ptosis. Specifically, there's an eye drop called UPNEEQ, oxymetazoline hydrochloride ophthalmic solution, 0.1%, and it's the first and only improved eye drop for adult patients with acquired ptosis.
Wow, I can't wait to hear more about it. I had no idea that there are non-surgical solutions to droopy eyes.
Excellent, but while you're working on my face, first I want to hear a little bit more about your clients and what it is that they're asking about when they ask about droopy eyelids.
Sure, ask away. I'm not a medical professional, but I've had a ton of clients in my chair ask about what they can do to help appear like they have a more lifted eye using makeup techniques, tips and tricks.
Okay, so first things first. When did you get started doing makeup?
In 2009, I got my first big break working for MTV on a reality show, and that prompted me into having relations and future clients with a lot of people in the industry, and I've never stopped since.
What a cool background. Now, I know you're not able to tell me who's got ptosis, but of those patients who come to you and complain about their droopy eyelids, what is it exactly that they ask?
I've had many clients over the years complain about droopy eyelids, making it much harder for them to apply eye makeup, especially eyeliner and eyeshadow. I get asked all the time what they can do, and they mention that they look tired even when they're not.
I know that someone's droopy eyelids can really impact their self-confidence. Do you have clients that come to you with that question?
I do have some clients that say that it lowers their confidence and that it ages them.
So when those patients come to you for makeup advice, what do you tell them?
So whenever I have a client who is concerned about having droopy eyelids, I always make sure to educate them on the reflection of light on your skin and how we can create light and shadows. So this is very important when it comes to the eyes, where we want to bring in light, where we want to have shadow, lifting. So all of these techniques bring everything in together. So Dr. Soleiman, I didn't realize that droopy eyelids is an actual medical condition. Can you tell me a little bit more about that?
Acquired ptosis is a condition where our eyelids get lowered as we age. It's a condition we probably all are aware of, we just don't know the name.
That's so interesting. Who can get ptosis?
Pretty much anyone can get ptosis, even though it's very common in aging adults, which is what I want to focus on today. I've actually seen it in a range of different ages throughout adulthood. There's really no specific precondition to acquired ptosis, even though family members having it can be a possible indication. It's very important to have patients screened to make sure that they have acquired ptosis before prescribing them UPNEEQ, because there are medical conditions and neurological diseases that can result in lower set eyelids. It's important for patients to discuss all their symptoms with their doctor.
So, what can people do if they've acquired ptosis?
As you know, makeup is usually where people start, and usually the second step that they think about is surgery. However, other options do exist. I really like that UPNEEQ is a non-surgical, non-injectable treatment. UPNEEQ can help with the eyelid in patients with mild, moderate, and severe acquired ptosis.
Being able to treat ptosis without surgery is amazing. You mentioned UPNEEQ. Can you tell me a little bit more about what that is?
Absolutely. UPNEEQ is a prescription eye drop that can lift droopy eyelids within minutes of application. It can easily be administered at home or on the go or at any time. One drop is placed into each affected eye while keeping the head in a reclined position for 1 minute. You roll the eyes around and you're ready to go. It's just one drop once a day in each eye experiencing acquired ptosis.
One drop once a day sounds so simple to incorporate into your skincare routine. How long does it take to start working?
Yep, it can start in as little as 15 minutes and it can last about 6 hours. It's literally just a few minutes of your day and your eyes are going to look more lifted. And if you have severe ptosis, it can even improve your field of vision.
Wow, I can really see myself using it. Are there any side effects?
I always evaluate my patients before prescribing UPNEEQ to them. And I also have to tell them about their common side effects. Those side effects include eye inflammation, eye redness, dry eyes, blurred vision, installation site pain, eye irritation, and headaches.
Obviously, I'm new to this, but if there was one thing you can tell your patients or my clients who are suffering from droopy eyelids, what would it be?
You have options. Ask your healthcare provider about all the different options available to you. Your prescriber can evaluate your ptosis and your medical history to determine the cause of your droopy eyelids and whether you might be a good candidate for UPNEEQ. Your provider can also discuss with you the benefits of treatment and potential side effects.
Yes, I agree. Everyone should consult with their physician and see what their options are. Let's say I have a client who's prescribed UPNEEQ. How would they go about refilling their prescription regularly?
After the prescriber determines that UPNEEQ is right for them, they can get UPNEEQ through IVL pharmacy. The pharmacy will then reach out to them and ship UPNEEQ directly to their home. Some med spas with licensed physicians have also started to carry UPNEEQ.
In your opinion, what is the most beneficial part of getting patients with acquired ptosis on UPNEEQ?
Well, it's non-surgical, it's non-injectable, it's easy to carry, it's easy to apply it anywhere, and it's very quick to start working. This looks amazing. I'm always impressed with how fast you can pull this together.
Well, like I said, this is a pretty simple look and it should take anyone about 10 minutes from start to finish. Similar to UPNEEQ, it's easy to work into your daily routine and it won't slow you down.
Agreed. Thank you so much for today, Pam. This has been so much fun. And I hope that as your clients come to you and you notice droopy eyelids, you can direct them to their healthcare provider to get evaluated.
Absolutely, Dr. Soleiman, and thank you for taking the time to tell me about UPNEEQ.
You can learn more about acquired ptosis, UPNEEQ, RVL Pharmacy, and see important safety information at www.upneeq.com. And as always, be sure to talk to your personal healthcare provider for more information and to determine if UPNEEQ may be right for you.
Important safety information. What is UPNEEQ? UPNEEQ, oxymetazoline hydrochloride ophthalmic solution 0.1%, is a prescription eye drop used to treat low-lying lids, acquired blepharoptosis, in adults. What warnings and precautions are associated with UPNEEQ? Low-lying lids may be related to conditions such as stroke and/or brain aneurysm, Horner syndrome, myasthenia gravis, loss of the ability to move eye muscles, eye infection, and eye tumors. Ask your doctor if you have any of these conditions. UPNEEQ is a type of medication that may affect your blood pressure. If you have heart disease, uncontrolled high or low blood pressure, or feel faint at rest or when quickly standing up, You should call your doctor if your symptoms get worse. Patients with reduced blood flow to the brain or heart, or patients who experience eye or mouth dryness due to an immune system disorder, Sjögren syndrome, should use care when taking UPNEEQ. Call your doctor immediately if you feel your symptoms may be getting worse. UPNEEQ may increase the risk of eye pressure due to fluid buildup, angle closure glaucoma, in patients with untreated narrow angle glaucoma. Call your doctor immediately if you feel increased pressure in your eye after using UPNEEQ. Do not let the tip of the UPNEEQ vial touch your eye or any other surface. This can help prevent eye injury or contamination. Each UPNEEQ vial is for one-time use and should be discarded after being used. What are the most common side effects of UPNEEQ? The most common adverse reactions with UPNEEQ occurring in 1 to 5% of patients were eye inflammation, eye redness, dry eye, blurred vision, eye pain at time of use, eye irritation, and headache. What should my doctor know about before prescribing me UPNEEQ? Your doctor should review your full medical history before prescribing UPNEEQ. UPNEEQ belongs to a class of medication, alpha-adrenergic agonists, that may affect your blood pressure. Use UPNEEQ carefully if you currently take an alpha-adrenergic antagonist medication to treat heart disease or an enlarged prostate. Patients taking beta blockers or other medications to treat hypertension or an abnormal heartbeat should also be careful when using UPNEEQ. Patients who use a certain class of antidepressant medication, monoamine oxidase inhibitors, should also be careful when using UPNEEQ, as it may affect the way your body absorbs the medication. These are not all of the possible side effects of UPNEEQ. Tell your doctor if you have any side effect that bothers you or does not go away. Call your doctor for medical advice about side effects. To report side effects or product complaints, contact RVL Pharmaceuticals at 1-877-482-3788. You may also report side effects to the FDA by calling 1-800-FDA-1088 or visit www.fda.gov/medwatch. This document has summarized the most important safety information for UPNEEQ. For more in-depth safety information, please review the full prescribing information for UPNEEQ.